Rise today to speak about the nomination of Robert Gordon. Earlier this year, Mr. Gordon had strong bipartisan support in the Finance Committee when his nomination came to a vote. Mr. Gordon is President Biden's nominee to serve as the Department of Health and Human Services Assistant Secretary for Financial Resources, and he has a long history of dedication to public service. More recently, he served as Director of the Department of Health and Human Services for the state of Michigan. He played a central role in the state's pandemic response and managed an agency of 14,000 employees and a multi-billion-dollar budget. Before that, he held senior roles in the U.S. Department of Education and the Office of Management and Budget, where he championed evidence-based policymaking to use taxpayer dollars wisely. Earlier in his career, Mr. Gordon served as a senior official at the New York City Department of Education. He was a senior aide on Capitol Hill, a law clerk for Justice Ruth Bader Ginsburg, and a White House aide. In his time at the White House, he supported the development of the AmeriCorps program. In his long career in public service, he's worked to ensure that government programs work for those they serve and that they do so through responsible use of taxpayer dollars. Such experience is essential to the work of the Assistant Secretary for Financial Resources at the Department of Health and Human Services. HHS has responsibility for critical programs like Medicare, Medicaid, and the Children's Health Insurance Program, just to name a few. The Assistant Secretary for Financial Resources must ensure that these programs and many others under the umbrella of the department remain strong for future generations. So, Mr. President, I ask unanimous consent that as if in executive session, the Senate consider the following nomination. Calendar number 762, Robert Michael Gordon, to be Assistant Secretary of Health and Human Services, that the Senate vote on the nomination without intervening action or debate, that if confirmed, then the motion to reconsider be considered made and laid upon the table, and that the President be immediately notified of the Senate's action.
Is there objection?
Mr. President.
Senator from Tennessee.
Mr. President, reserving the right to object, since last year, I've been asking for a commitment from my Democrat colleagues that any future reconciliation legislation in this Congress will not incorporate policies that will reduce access to care in non-expansion states such as Tennessee. Specifically, my concern is that the reconciliation legislation that the House of Representatives passed last fall, which is the very vehicle for the reconciliation bill currently being discussed in the Senate, included provisions that cut DSH and uncompensated care pool payments for non-expansion states. This would result in less health care for vulnerable populations in my state, it would accelerate hospital closures, and it would disadvantage rural communities. These are places and populations for which we're trying to secure more quality health care, not less. Because I still have not received confirmation that these provisions will not be included in the final text of the partisan reconciliation bill, I cannot consent to expediting confirmation of this nominee. And therefore, Mr. President, I object.
Objection is heard.
Mr. President?
Senator from Pennsylvania.
I want to respond, at least preliminarily, to my friend from Tennessee. I appreciate his advocacy for hospitals in his home state of Tennessee. And given that he's seeking this assurance about these disproportionate share hospital payments, my understanding is that the reconciliation bill we're about to consider this week does not contain any provisions that are directly relevant and any provision that would impact these disproportionate share hospitals or uncompensated care pool funding. So given that, and given that he's seeking this specific assurance about the pending reconciliation bill, that it not, and I think it's evident or will become evident that the bill does not contain these DISH provisions or uncompensated care payment cuts. I'd ask him just this question, if he would entertain this question. If the Senate does pass a reconciliation bill, which I hope will be by the end of this week, and that bill is then subsequently enacted into law, will he lift his objection and allow this and other relevant HHS nominations to be confirmed by unanimous consent?
Mr. President, I'd like to respond to my friend from Pennsylvania. That is a very reasonable request. We're getting ready to go through a process for which I've not yet seen the text, an amendment process that's hard to anticipate, and I dread to think that there would be another wraparound, but that could happen as well. But assuming that we get to an endpoint, and this language that I've discussed is not in the bill, the same language that the House included is not in this bill, I would be more than happy to lift my objection.
Thank you, Mr. President. I would yield the floor and note the absence of a quorum.
Clerk will call the roll. Will the Senator